And welcome into Your Health. You know, as we start to age, there's lots of things that can go wrong. One of the things we're told is when you hit a certain age, maybe 45, maybe 50, that you need to have a colonoscopy. It's one of the best things you can do. But a lot of times you're having a colonoscopy, you might say, well, I had that, but I'm having trouble swallowing, or there's some other areas. Today we have with us Dr. Atiq, and you are a gastroenterologist. And Dr. Atiq, when we hit a certain age, that's when we should start to have more of our internal digestive system looked at.
Yeah, so typically if you follow the guidelines, the current guidelines recommend that people who are age 50 plus, or if they have any family history of colon cancer in their family or history of colon polyps, then they may require earlier colonoscopy. But if they don't have any family history of colon cancer, then when they reach 50 years of age, then they should go for a screening exam for to detect a colon cancer. Now there are certain ways you can check for colon cancer, and the best test, the most accurate test to check for colon cancer is colonoscopy, and we do offer those services here. But that's for screening purposes. A lot of people we see in our practice are coming actually for some other reason other than screening purposes. That sometimes has abdominal pain, and a lot of our population here in this community actually has a lot of constipation, and that actually, if they don't have any prior workup for constipation, certainly colon cancer or any obstruction can also present in sudden onset and constipation. So that's one thing we should always make sure we go to the regular doctor, primary care doctor, or have a visit with gastroenterologist to check all of these things, because colonoscopy, constipation can actually, because of several reasons, either there's an obstruction there, there's a problem passage of stool through your colon, just decreased motility, or it could be having trouble with just getting it out, like an obstructive problem in your lower rectal area.
Let me ask the question. Okay, when you're talking about constipation, probably a lot of us have had constipation maybe for a day or two, but is there a point where you've been constipated for over 5 days that you start to say, something's going on here? Is there a certain...
So there's no, everybody has a different bowel habits, and it's pretty normal for them. Some people actually go 3 times a week, and then that's normal. If it's not bothering their habits and bothering their lifestyle, then it should be okay for them. But any sudden changes in bowel habit, like if they're having regular bowel movements, suddenly they notice that for last 1 month or 2 months they're having more constipation, just going once a week or like 3 times a week, and previously they're going every day. That's actually a red flag, especially when you cross 50 years of age. Other red flags to notice is to make sure you go for a checkup, is to see blood in your stool. Even if you just wipe and think that it's a hemorrhoidal bleed, but we want to make sure that it's just a hemorrhoidal bleed and not actually coming from top above or somewhere else, because that's also a red flag. Anything, if you start losing weight, unintentional weight loss is also a red flag with constipation. So all of these things, any sudden changes in bowel habits, whether it's coming from constipation to diarrhea or from diarrhea to constipation or from regular to constipation, that's always needs actually a checkup.
And the constipation, obviously, can it be caused by your dietary habits?
Definitely. Diet actually plays a major role in actually, for some individual, to cause a lot of problem with constipation. Some people actually, their bowel habits are so adjusted that they don't have any trouble when they're young, but then over a period of time, when they actually have trouble with when they change the diet, that can actually significantly contribute to that. Especially a lot of people actually don't eat fiber in their diet, and that fruits when they're young, but then as they grow older, they require more and more fiber in their diet to have a regular bowel movement. So fiber plays an important role. But as I mentioned, anything which changes recently and it continues to be a problem, that require a checkup.
We heard the old saying, an apple a day keeps the doctor away.
Definitely.
And of course people go, what's that all about? Well, of course, an apple is a very good source of fiber.
Apples, prunes actually is pretty good.
Oh, yes.
Fiber.
Absolutely.
Dates and everything, and I mean, as you can go with natural, that's awesome. I usually recommend prune juice or prune, to eat prunes. The first thing when I see a patient, if they fail all of those things, then we can go all over the supplemental stuff like any over-the-counter fiber product, and they can use that also. But it's always be healthy to stay with the natural diet.
So what would be an ideal breakfast for a patient with that problem?
So you can actually introduce lots and lots of, if you don't have any contraindication, I would say if you can use plenty of water, you should drink plenty of water. And also it is very important to use a high fiber diet. And high fiber, as mentioned, that dates, prunes, all green leafy vegetables, that's possible that you can do. But other than that, you can introduce oatmeal, and that's just not related to just related to actually gastroenterology, but anything which has actually refined carbohydrates are actually not good for you, because all the refined carbohydrate do is go into your stomach, get digested, increase your sugar, and if that sugar is not wasted, it's gonna contribute making more fat in your body. So it's not an ideal way. So always stay with the complex carbohydrate, like fruits, vegetables, and I mean oatmeal is good, but try to avoid refined carbohydrates.
What are 3 refined carbohydrates that we need to stay away from?
So anything like sugar is big thing.
Okay.
So anything sugary is actually definitely a refined, because you actually refine it from that product. And other than that, like rice actually is can also cause that. Brown rice are okay, but anything, I would say white is actually bread.
White bread
is not very healthy. I mean, you can have it, but actually just try to select portions of it so that you can enjoy your meal also, but then stay healthy at the same time.
Good. Well, Doctor, we thank you very much. We're so happy to have you here in Montgomery. We hope it's going to be a very wonderful place for you and your family. Those 2 beautiful daughters.
Definitely, yes.
They're going to have a good time out there.
Definitely.
And just remember this, the clinic is at Baptist South, which is on the Southern Boulevard here in Montgomery. No referral is necessary. And especially, again, as the doctor said early on, if you hit that age of 50 and you've not had a colonoscopy, you need to get a baseline. We'll be right back right after this.